stimulates it to start working and pumping again, reproducing. So here we go, ready? 1, 2, 3. How's that feel?
Fine. Like a little rubber band.
Like a small rubber bands now.
You have Adriana Kish watching if you want to say hi.
Hi, Adriana.
So when can I start to see like symptoms?
You're going to notice the darkening of the sun damage immediately. It'll get darker over the next couple of days, and well, your skin's like a really peeled. It'll just kind of like when you go to the beach and you get sand on your skin is damp, and the sand sticks to it as your skin dries. The sand just kind of falls off, and that's what will happen as your skin cells just shed. Spots will just shed. It's recommended that you do this twice a year. Once we get the first time that you get it done, you want to do it for correction. So we're correcting your browns and your reds. After that, your subsequent, would you put your tongue over your teeth for me, please? There you go. After that, your subsequent treatments are actually for anti-aging.
You have a Randall Davis watching and a Kathy Hudson Haskins. If you have any questions, just let us know.
So after this one, when do I do my next?
We'll check up on you in 3 weeks to see if we have any that are stubborn. And if not, we'll just see you again in 2 to 3 months. We'll do your next treatment.
Oh, okay. After the summer.
Yeah, and it's kind of a good cleanup. People think that you can't do laser during the summer. From Louisiana, and if that were true, we would never be able to do lasers because it was the land of perpetual summer. So, for anyone out there thinking you can't do a laser treatment in the summer, the only thing that I require is that you don't go out and sunbathe or be in direct sun. You know, not walking to and from your car, regarding you have some sunscreen on, but just not out sunbathing for 2 weeks prior to your treatment and 2 weeks afterward. And then coming back in after the summer, it's a good time to clean up any damage that you may have occurred so that you won't be accumulating it year after year and needing a big makeover. How's it feeling?
Oh, fine.
We'll get back and we'll take care of some of those peskier big spots that you pointed out that you're really concerned about. So put some of the ultrasound gel on this.
So in between now and 3 months, what else would you recommend that I do?
You're going to be using a really good sunscreen every single day. Good skincare is very, the one thing that most people just don't really seem to understand is that whether you're buying Maybelline or Chanel, Laura Mercier, that they cannot penetrate this part of the skin that you can touch, because anything that does that, if it goes down into the skin, is considered medical. And so if you'd have to go in to your dermatologist's office or go somewhere where someone with a medical license can actually purchase the skincare. So if you're in your 40s and 50s and 60s, I would highly recommend that you get some. And the most amazing thing about it is it's almost always cheaper than anything that you can get at the mall. You can get a really good moisturizer that's going to affect change. The Elastoderm eye cream with BioBaji in 2 weeks can amazingly reduce the number of crow's feet you have around there in 2 weeks. But you wouldn't see a change with something over the counter in 2 years. And I know because I did that for years.
Michelle, where can you use this? Anywhere on the body, the hands, neck, where?
That's a really good question. You can do this on any part of the body. And I always want to, after when I've treated the face, I always want to do the neck, the décolleté, and the top of hands, because it doesn't make any sense just to have a really flawless face and have sun damage through here and on the hands. You want to knock it all out.
How much is your treatment?
The treatment that Darlene is getting today is $500. And normally people would charge you $500 just to do the face. Or if they charge you a little bit less, they would still charge you just to do the face. They would add on for the neck. But that's just my gift to my patients. I'm going to stand out from the crowd moment. It's because I'm going to treat all of it so that everything flows and it's really wonderful.
Right. And I know I had the
Steve
opportunity-
Landis is watching. If you want to say hi, and a Gary Ford.
Hi, Carrie. Hi, Landy.
Why should people come to get the Sciton laser treatment over the other laser treatments?
Yeah.
Well, you know, that's a really
That's
fantastic. That's a fantastic. The Sciton is definitely the Maserati of all of the lasers. And for over a decade that I've done this, I've used so many different lasers. And at some point, some of the treatments I would do 6 or 7 times. The doctors or the laser technicians, they were making tons of money on these patients and weren't getting the results that I can get with 1 or 2 treatments on the Sciton.
I've had IPL before, and it was a little more comfortable. And
How long should you stay out of the sun after you get this treatment?
You're going to stay out of the sun 2 weeks post-treatment. And I don't mean like you can't go out in the sun. I'm saying you can put sunscreen on and a hat if you want to go and do something around. You're going to take your kids to a soccer game. But if you're going to be going to the beach and you're going to be like laying out in the sun, I'm going to ask you not to do that for 2 weeks prior to your treatment and 2 weeks afterward.
On average, the common person that comes in and gets 3 to 5 treatments, on average, how much younger is their skin going to look after 3 to 6 months?
And if they're getting treatments done regularly, they'll probably be getting them done about once every, well, I would say with the change of the seasons. So say every spring, summer, winter, fall, come in and get it done. You will start to notice if you go to Sciton.com or if you were to Google Loudoun Medical Aesthetics and go to our videos, you'll see Dr. Patrick Bitter, who actually created a lot of the technology for BBL and the Forever Young BBL. And the studies that they had where they took pictures of people who were 45 and 46 years old and then took them to some peers who have been trained to be able to tell you what your skin would look like, i.e. plastic surgeons, dermatologists. And the plastic surgeons and dermatologists all were spot on. They said they're 45 to 46 years old. They did them for four times a year to change up all the seasons for the next decade, took those pictures back to different surgeons and some of the things, and they thought that the people were 45 to 46 years old, when in fact it was the same group who had done it 4 times a year, and were now 55 or 56 years old, and were being guessed a full decade younger than they are. So again, go to Loudoun Medical Aesthetics, Google it, and look at the videos that we have, because you'll see Patrick Bitter, and he is actually 64 years old, and he looks like he's 34. Looks amazing.
How long have you been doing this, Michelle?
I've been doing this on this laser for the past 12 years. I've been doing lasers off and on for 18, almost 19 years now.
Darlene, what other treatments do you offer that can be combined with this to improve overall looks and anti-aging?
Well, one that I think goes really well with it is the vampire facial. That's where,
Absolutely.
yeah,
I did that.
dry your blood and thin it down. And microneedle with BRP. That will help as well with texture, discoloration in the skin, any type of pigmentation, scarring, and stuff like that. This won't just adjust scarring, but that one will. So give you some flow of the skin. Also, we do the fillers and Botox, which are kind of our standard procedures. And in addition, the vampire facelift, which will help more with volume.
You have a Rhonda and a serial watching. If you'll say hi.
Hello.
Hi. And I think that one of the most important things to know that's a great marriage between what I'm doing to her and what she does is that this is addressing the textural, the issues that are on the skin. What she's doing when she's doing a vampire facial is actually changing the texture and the tone and the visible lines and wrinkles.
You have a Amy watching. If you want to say hi.
Hi, Amy. So if you guys have any questions, you can shout them out right now because we'd be more than happy to answer you.
If you just leave us a message on here, we can. I can ask Michelle and Darlene here. You got a like. Thank you.
Almost done. Great. And immediately following this, Darlene is going to be doing a PRP with the vampire hair restoration, because for the last couple of years, I think it's my hormones, my hair's been thinning to where it really is smoke and mirrors. Well, right now I don't have anything in my hair, but it's noticeably thinning, and you can actually do the PRP treatments for hair loss. And so she's done these for a number of years and is going to be doing me next, so that we can get some regrowth. Got some.
Because the PRP will activate your stem cells and growth factors to come to that area that you're injecting it in and form new tissue. The hair is going to form new hair follicles, new blood vessels to help with hair restoration. With the facial facelift, it's going to form new collagen. Increase the blood supply as well.
So we know plastic surgery is needed in some instances, but what are benefits of why you should get Sciton laser and some of the injectables you offer and microneedling? Why should you do these procedures over? What are the benefits over plastic surgery?
So many benefits. Oh my goodness. You go
Zero downtime.
No downtime. Thousands, at least $10,000 or more difference in your finances. You're not messing with. You're going to have swelling and redness that's going to last because of the trauma to the face for months and months and months after plastic surgery, whereas you have none of that following any of these procedures.
Now, why should you combine these procedures with the medical grade skincare that we offer here? Why should you get that over getting things at Walgreens or Costco or Walmart or CVS? Why should you get these other products, and how does it relate to the procedures that you two offer?
Again, it's going to continue. It's going to complement what you're doing. Now, you made an investment in your skin, and you want to some medical grade products that you can only get in a medical office. It has a higher content of some of the active ingredients that you won't find in over-the-counter products. Or even online. I know some of them are sold online, but they're not the higher percentage of like salicylic acid, retinol, and, for example.
And I also want to say, beware if you can find something on Amazon or Google that is something that you would normally only be able to get, like a Zeo or a Baji or some of these other ones, because sometimes practices will go, this is just one that I have found out about, sometimes a practice will go under and the doctors or whoever is in charge of the clinic will sell to Amazon to get rid of the stock. But the problem is that these products were made to be kept within certain temperatures and for just so long on the shelf life. And you don't know where it's coming from, how hot of a warehouse it might have been held in, how long it's been on the shelf at the doctor's office. Whereas here or at your dermatologist, plastic surgeon, you know exactly, they know how long they've had that product.
Do you all take insurance, and if not, do you have any sort of payment plans for people that really want these procedures but just don't have complete out of pocket at the time of procedure?
We do offer financing. Care credit should be available soon, and upon consultation, a lot of our patients will just ask us if we can break payments up, and we work with them.
Is there any sort of memberships you offer?
We do offer memberships. You can, it's just like a gym membership, but better. Because with your gym membership, you're deducted, and if you go to the gym or not, you can get that money is gone. If you do the membership here, that money is just kind of banked on the side. It's not spent. So when you come in after having, let's just say you have $100 that comes out of your checking account every month, it's put in a bank over here, and that just set aside for you. So when you come in, let's say in 3 months, and want a $500 procedure done, you already have $300 banked, and you only have to, it's only going to be $200 extra out of pocket for you.
Is there any cancellation fees?
No. You can cancel at any time.
Why did you two choose this career path?
Because that's an excellent question. I was working with skincare. I was in a retail with fragrance and doing a lot of different things with sales. And I was selling skincare, and my patients, my customers at that point, were asking me what I was using on my skin because my skin looked so good. And I wasn't going to lie to them and say this $500 jar of Armani, Cremonera, or whatever. When I knew that I was going and getting my BBL, my microneedling, my Botox, my filler, whatever it was that I needed at the time. So I know that I wasn't going to lie to them, so I would just give them the name of my dermatologist. So when I did that, I decided, I was thinking, why not just go ahead and cut over into this as a career path just for good, and have never worked a day in my life since. Love it.
How about you, Darlene? I know you can't see anything and you're getting procedure and being real patient,
well,
but...
Yeah, I've been a PA, physician assistant since 2003. So I practiced in several different medical specialties, but this one for the past 6 years. And I just really enjoy helping patients, feel good about themselves. And, they walk out feeling happy, they're just younger and just like more positive.
People are happy when they leave. People are happy when they leave. And that's the
it's
biggest
fun to
payoff,
see.
is that when they leave, they're really, really happy. It's not like they've been to the doctor's office or something. And both Darlene and I love our patients.
Mm-hmm.
We love spending time with you. We probably spend too much time, but like sometimes just because we like to just sit here and talk.
We have fun.
We have fun. And so a lot of people come in here because they know that they have a great relationship with us.
I didn't mean to interrupt. That is, for a joke. Can you show us what you're holding, Darlene?
What am I holding?
Your elephant.
Oh, my elephant?
Oh, okay. There you go.
It's the office
Just to lighten it
mascot.
up.
The office mascot, it's like a teddy bear.
Yeah.
So our office mascot. So if anyone does want to have a little comfort while during their things. Not that she was in pain, but if you want a little bit of comfort, we'll be more than happy to provide you with the elephant. We haven't named him yet, so we're open to names. So if you'd like to throw some names at us, we would absolutely love to take a vote and figure out what the name of this elephant is going to be, because right now we are trying so hard and we just keep saying the elephant, the elephant, the elephant. So right now I'm thinking, like, why don't you guys throw out some names so at least he can have a name. Look how cute he is. Look how cute he is. So he deserves to have something other than Dumbo. You know, so like give us some names, because we'd love to do that. And it will actually let you guys know who gave us the name. And we'll be really excited about it. Who did it? Who did it? Who's going to send us that name? So yeah, we'd love for you guys to throw some at us.
Okay, well, why should people check out the YouTube channel? We have some videos being posted up there, so definitely check them out in the future.
Well, if you go to YouTube and you Google, and you can actually, like I said, if you Google Loudoun Medical Aesthetics YouTube, we have some great videos for you to watch about the procedures that we're going to be doing. This will be posted up on there. The next procedure that Darlene is going to be doing with my scalp, and I will have the camera right up on my head so you can see actually without all of these different things how thin my hair actually is. So you'll be noticing my progress, and every week, every single week, I'll be giving you an update on my scalp without any smoke and mirrors, just exactly how this is working for regrowing my hair.
And I just have one more question. Why? There's amazing medical spas all over the world. Amazing medical with very, very talented, great people. Why should people choose here? Other than, it's a fantastic location near Dulles Airport and, DC. But why should they come here and, drive here or fly here or, come visit, Northern Virginia? Why should they come here and see you two?
Well, I think that's a really easy one, because this is a one-stop shop. You don't have to just go somewhere and get a laser treatment by a generic laser person who really doesn't care. I care. And then you can go and you want to get Botox, filler, you want to get a vampire procedure done. Your child has acne, and they've got acne that you don't want to put them on Accutane. We have acne treatments here on the laser. We have Forever Young, so you can come in here and start taking away the years. We have the microneedling. We literally have everything that you need to reverse your age right here, so you don't have to run all over the place. And then you get the added benefit of us.
But also, I think we have a lot of combined years experience doing this, and we love our patients, and we really want to do what's best for them. So I think when everybody comes in here, it feels like part of our family. And yeah, we'd love to have you come in.
So you've got a great combination. You've got at least 30 years experience between the two of us in aesthetics, in anti-aging, in addressing anything that you want. And if you don't know that this is for you, here's my one question I'm going to leave you with. If I had a magic wand in my hand right now, and I could wave it over your face and get rid of one thing, what would that one thing be? Because everybody has one thing. So that's why you should call us. We can take care of that one thing.
Well, great skin doesn't happen by chance. It happens by
appointment.